Okay, so our next speaker is Sonia Batra, who's a local dermatologist, and actually is pretty well known for her work on the show The Doctors, and is quite a good speaker. And we asked her to present a really interesting topic. I think is the utility of sunscreens. So thank you so much, Sonia, for being here today.
Thank you. Dr. Esmer, thanks for having me. Dr. Margolin, I'm so excited to be here and share some information with you. So this is to advance the slide just forward, right? So the topic is what you need to know about skin protection. And so I kind of thought it would be twofold. One would be talking about primary prevention with sunscreens. And then also because sadly a number of you in this audience are going through therapy, I wanted to talk about what you can do to protect your skin if you are unfortunately going through some treatment for your melanoma as well. So there's kind of two parts to this talk. As you've heard probably already this morning, we all know, sadly, there are a number of melanoma risk factors, and many of them are out of our control, right? High number of moles, especially if you have a number of them that are atypical, if you have a family history, a personal history, blonde or red hair, light eyes. Those are all things that, that's the hand you're dealt. But the two things that I think you should know about skin protection are that risk factors include childhood sunburns and intermittent adult exposure to ultraviolet light. And so there are things we can do to help you with this. And really delving a little bit more into ultraviolet exposure as a melanoma risk factor, we know that your lifetime risk of melanoma is increased if you have more than 5 childhood burns. We also know that repeat intermittent intense exposure is also very dangerous when it comes to increasing your risk of melanoma. And then my least favorite thing, and sadly and thankfully is actually a little bit less common here in Southern California, is use of a tanning bed. So anybody who has used a tanning bed more than once a month, or especially even those people who go and prep for prom with tanning beds, the worst thing you can do. And you will get a lecture from me. Some of you are my patients and you know that if I hear you're using a tanning bed. And despite all this awareness and obviously incredible forums like this, I often get a question as to why skin cancer is one of those very unfortunate cancers that's increasing. And we don't know for sure, but we think there are a couple contributing factors. One is, of course, people's sun exposure habits, and people still are out there tanning. And if you live in a cold area, you no longer stay there in the winter. You go somewhere very sunny when you can, and you sit out on the beach, or you get those high intensity exposures, even like skiing, where people don't realize how much ultraviolet is being reflected off of snow or that they're at an altitude. So there's a lot more exposure going on in both our day-to-day life and in our leisure time. The secondary thing is also that the ozone layer is much thinner. As air quality decreases, the ozone layer, which used to absorb a lot of that ultraviolet, is thinner. And so 10% more ultraviolet radiation is reaching the surface of the Earth. So we know that there's even more damage. And while we always talk about UVB, because that's the shorter, more carcinogenic, more dangerous sunburn-related part of the ultraviolet spectrum, when we talk about ultraviolet being released from the sun, UVA plays a huge role, and that's the longer wavelength ultraviolet that actually penetrates the glass of your driver's side window that hasn't really gotten as much attention, but we know contributes to skin cancer risk as well. And in my line of work as a dermatologist, to wrinkles, to brown spots. So it's definitely worth having on your radar. And then this is just, it drives me crazy as a dermatologist because on a really nice summer day, everybody's out there without their protection, just baking. And so I think the primary thing what you should know about skin protection is, of course, education. And so I like this photo because it's from a very old campaign in Australia where they raised awareness about sun protection. It was called Slip, Slop, Slap. And the idea was really just from a very early age to normalize protecting your skin from ultraviolet rays. And here in LA, I love being outside. Anybody who knows me well knows I'm a very avid golfer, but there are a lot of things you can do to really protect yourselves when you're out. Certainly seeking shade, sun avoidance. I'll delve into a lot about sunscreens, maybe more than you wanted to know. Hats, and of course, checking yourself self-exams. Those are all things that should be on your educational radar if you're thinking about preventable risk factors for melanoma. And so images like this, where ultraviolet, like baking, tanning, using a tanning bed, really the education has to be that this is not normal. This is not a healthy, good thing to do. And so this was really easy for me. I just did a Google search of show me what it looks like to be healthy and tan. And right away I got these images. And that's kind of a really sad aspect about our public health education and our awareness. And I realize I'm preaching a little bit to the converted in this room. But when we talk about sun protection, if you're someone like me, you love golf, you're a tennis player, you have to walk your dog, or there's something you do, try to schedule those activities outside of peak UV index hours. That's before 10 a.m. and after 4 p.m. because that's a really simple tweak, and your skin and your general kind of sense of overheating and well-being will thank you for it. Seek shade. Like if there's one tennis court that's in the shade, go there, as opposed to necessarily being out and frying when you're out and playing. My kids always mock me because I always will try to find the shadiest path wherever I am, and it can be sort of maddening to them. It's actually easy to do, and it's a simple, small intervention that actually pays huge dividends. And I also think that protective clothing has come a long way, and it's worth putting that on the radar. I think when I tell my patients about protective clothing, everybody thinks about the goofy photo in the corner with like this guy with an umbrella on his head. But I think it's a really simple thing you can do to see if your clothes are giving you adequate UV protection, which is just hold them up to a bright light. And if they're a narrow weave and you don't see light penetrating through your fabric, then that is sun protective clothing. You just always have to be wary, because I have a lot of patients who wear mesh loose weave clothes, which absolutely allows the ultraviolet to still penetrate, and then are shocked when they have signs of sun damage, skin cancer, or burns. So that's a simple thing. Now, with the improvements in technology, we have ultraviolet protective factor even in our fabrics. So it's not wildly expensive. It's not very heavy and causing people to overheat, but you can look for UPF in your fabrics too. And there's a range of retailers that sell UPF clothing, especially if you're someone who's playing a sport. So easy thing to do. And then a hat with a 2-inch brim is always a good tool as well, because I think that also there's this misconception, for example, that a baseball cap is an adequate hat for sun protection. And while it is going to protect your scalp and some of your forehead, it's definitely not getting those lateral cheeks and neck. Though I would be wearing a Dodger hat today if I could, as I gave you the talk. I'm going to wear my Dodger blue dress anyway. So that's, what to look for in the hat. In terms of sunscreen, just normalize it. Make it part of your daily regimen. I always tell my patients, spend a few minutes, get a moisturizer with sunblock that you will wear every day, that doesn't look chalky, that doesn't feel gross, that doesn't feel sticky when you put it on. And that's going to be very individual. I am not particular about brands, but anybody who knows me, who's my patient, knows I'm extraordinarily particular about ingredients. And so I tend to favor things that are physical mineral blocks with micronized zinc oxide, as well as non-nano titanium dioxide, because those are the physical ingredients, and I'll talk about this a little bit more in depth, that block both parts of the UVA as well as the UVB spectrum. So they are broad spectrum, and that's something to look for in the labels of your sunscreen. I think the other thing that most of us don't do is apply enough, because remember, when these companies are getting an SPF label for their product from the FDA, they're putting 2 grams per square centimeter of skin. That's a ton. That's 1 ounce per application on your body, as I'll get to. And so if you think about it, like the average bottle of sunscreen you buy from the pharmacy is 1.7 ounces. It should be lasting you 2 applications to get the SPF on the label if you're putting it on your body. And that's really, nobody uses that much. So remember, when you're only applying a little sunscreen, you're not getting the SPF on the label. And the other thing that many of us don't do is when we think we've done an incredible job and you've shellacked with your sunscreen, but then you go out and you hop in the pool or you get really sweaty, you do need to reapply. So every hour if you're wet, whether that's sweat or immersed in water, or every 2 to 4 hours if you are just sitting at a park or doing something outside, sitting at an outside table doing your work on your laptop. So do remember to reapply. And then I often get this question, well, how much SPF is really necessary? And I think it's worth mentioning, number one, that SPF only applies to the UVB block. So we're not even talking about UVA, and that's why looking for that broad spectrum product is important. And anytime you're above SPF 15, you're already at a 93% UVB block. So if the sunscreen you love is that's going to get you to put that sunscreen on every day, it's a 15, that's great. That's 93%. That's fine with me. I tend to recommend a 30 or higher. And then I always tell my patients, like, SPF 50, 98% UVB block, not really that much incremental benefit, but if you like that SPF 50 and that's what you'll wear, of course, that extra little help is great. And as I mentioned, there are different types of sunscreens. I tend to favor the physical ones because they're minerals that sit on top of your skin. They deflect ultraviolet light and they tend to be a lot less allergenic. These are the safest ones in kids or people with skin allergies. Chemical block sunscreens will absorb ultraviolet and convert it to heat at the surface of your skin. So it's just a different mechanism of action. They will prevent sunburn, but in my experience, heat is a big mediator of hyperpigmentation. So someone like me who's olive toned and might not be out burning, but is definitely going to get like a whole bunch of brown spots on that golf course. That's why mineral block is better, because that heat is otherwise going to contribute to discoloration. And that's one of the reasons I favor it. Also, if you put sunscreen on, you have to put it everywhere for it to work. This is a patient who said, but I use sunscreen. I can't believe I got burned. And I said, yeah, but this is where you use the sunscreen and you can see the islands of sparing. It's also a nice validation that these products actually do work if you use them, but you do have to get them everywhere, maybe have someone help you. Um, Other thing about getting that SPF on the label I already alluded to is use enough. So about a nickel should be enough for your entire face. And most people, especially if you're relying on, for example, your makeup to give you sunscreen, are going to use less than half of this. The other question I get is, can I add up the SPFs if I buy one that's SPF 7 and another that's SPF 8 or 10? And they are not additive, unfortunately, so you don't get the final SPF tally if you're layering multiple products. And I think one other sort of neglected area is lip balm, because it is a very common site of especially non-melanoma skin cancer, but sun damage and mutations in the skin. And one really fun fact that shocked me when I first learned it as a resident and totally changed my life was, if you're a woman and you're wearing a sunscreen or a lip product, you should go for a matte product, because gloss is actually, just like in the good old days when everybody put baby oil on to increase their sun exposure, a glossy lipstick or lip balm is going to increase the penetration of light and really fuel that sun damage. So really use something matte, because the gloss is going to decrease the light scatter. And then this is a little way to think about how much to put. And again, try your best, but these are the ideals. And this is the assays they did, is the size of a shot glass for your body, or 2 tablespoons. And then on the face, you could do the nickel or the size of an almond. And I don't know if anybody's measuring out quarter teaspoons, but that's the standard for the face. And then I'm going to change gears a little bit, as promised, because I do want to talk a little bit, not just about the primary prevention, but what you can do to protect your skin if you're unfortunately going through any sort of treatment. And so usually during therapy, I know Dr. Margolin already talked a lot about the mechanisms of these treatments for melanoma, but I think in my practice now, and I wonder if Dr. Schmidt and Dr. Latak feel similarly, I think in terms of seeing patients in the office for side effects from therapy for melanoma, I'm seeing many more from the immune checkpoint inhibitors. And the idea is that when you take the brakes off of these cancer-killing cells, these activated immune cells can go around and harm other organ systems, and the skin is kind of the primary site of toxicity. This is where we see a lot of side effects. And so first off, basic advice is, if you are going through any therapy for your melanoma, the more gentle and the more protective you can really seal your skin and maintain that barrier, the better. So these are the same recommendations I give to people who have really dry or sensitive skin, or maybe even have eczema. Not too long, not too hot showers or baths, because immersion in hot water actually breaks down the barrier of your skin, is going to make you more vulnerable. Scent-free, dye-free everything, from your laundry detergent to your cleanser to your moisturizer, because remember, your immune systems are already circulating. They're really activated. They want to get really irritated by anything they come in contact with. So if you throw a heavy fragrance at them or a very intensely colored product, that's going to be fodder for your immune system. And even if you've never reacted before, this is the context when you might. So the more you can withdraw any potential irritants, the better. And I know it sounds super cliched as a dermatologist. I already talked to you about sunscreen. Now I'm going to talk to you about moisturizer, because it does have a function, and that's to seal your skin and to maintain your barrier. Every organ in your body has a function, and your skin's is to keep the outside world out. So when you help it along with a moisturizer, you're going to help maintain that barrier, and it's just going to perform its function better. And then this is a really busy slide. I don't expect anyone to memorize it, but these are the range of different skin manifestations of reactions to immune checkpoint inhibitors. And it can range just from being super itchy to loss of color to very specific rashes with patterns under the microscope that, again, I think there's only a couple people in the room who would be interested in. But the idea is they can cause pretty intense reactions. And so this is kind of sadly a common skin rash we might see. And because we love jargon in dermatology, we're going to call that morbilliform because it's almost like a measles-like rash. But definitely intense itching, these painful skin rashes, which are in response. And if any of you have unfortunately experienced this type of reaction, you know that dermatologists do have an armamentarium, but those primary preventive tools, as I mentioned, are really best practice to try to minimize any toxicity to your skin. As a dermatologist, I tend to prefer creams and topicals. I really like the outside-in approach of calming things down, and especially because in the context where your immune system is already sort of being dysregulated, and in some contexts you're trying to rev it up, systemic steroids can be a little controversial because you don't necessarily want to offset any of the benefit of those immune checkpoint inhibitors. I'm a big fan of just over-the-counter camphor and menthol. That comes in like an over-the-counter product like Sarna. I have no commercial interest with them, but it's been around for 40 years. Very cooling, inexpensive, easy to find in a regular pharmacy or on Amazon. When indicated, a topical steroid or an anti-inflammatory cream that I prescribe or one of my colleagues prescribes, very appropriate as well. Good old antihistamines, really helpful. They've been around forever, and they just really shut down the histamine chemical that mediates a lot of the secondary itch from these reactions. They do work and help. And then if your symptoms are more severe, of course, there are prescription anti-itch drugs like gabapentin or pregabalin. We can use these mu-opioid antagonists like naloxone if we have to. So know that we have a pretty augmented armamentarium if you are really suffering, and that's where you should definitely talk to your doctor. This is definitely always in the literature in terms of using phototherapy, which is narrowband UVB. It has a very nice anti-inflammatory effect, but I'm not a fan of this personally as a professional because narrowband UVB is also carcinogenic. And I feel like to chase a skin cancer therapy with something that potentially could further harm the skin is very counterintuitive to me. So those are my dermatologist tools. These are my kids, my pride and joy on the beach in Hawaii, very, very protected from the sun. I put my email address at the bottom, so if any of you have questions that I don't get to address during this presentation or at this session today, of course, always feel free to email me. Thanks for your attention.
Questions for Dr. Batra?
Request from a dermatologist to burn off the keratosis on my head in this case, to use UV light. Was that a smart decision or a really poor decision?
I'm not really, I don't know if necessarily to burn off an actinic keratosis, which is a pre-non-melanoma skin cancer, as Dr. Litek said earlier. Usually no one will use UV light for that. They may use something called photodynamic therapy, which is where a solution would be applied to your skin to sensitize it to a blue wavelength of light, which is in the visible range. But very rarely would someone use ultraviolet light to address a precancerous non-melanoma type of lesion.
I refused the treatment for UV. That didn't make any sense to me, so
Yeah.
it gives me strike two against him.
Yeah, well, without throwing anyone under the bus, I will say that ultraviolet light has been used for decades in dermatology as an anti-inflammatory. I personally don't favor it for the reasons I mentioned because, like Dr. Litek, I'm double boarded in Mohs surgery, so I spend 2 days a week taking skin cancers out of people, so I'm not a big fan of therapies that might fuel them. However, for some people with very intractable inflammatory conditions, like just psoriasis that can't respond to anything and they're itching and they're miserable, or some people cosmetically who are really tremendously bothered by pigment loss conditions, it does have a role. I don't know, and I can defer to my colleagues, I don't know of any role of ultraviolet light in treating anything precancerous, though.
Thank you. What are your thoughts on, and this might be just like a theory from patients, but there's like a theory that sometimes sunscreen can inhibit the synthesis of vitamin D. Is there any fact to that claim at all?
So there is some fact to that claim about sunlight being necessary for the conversion to an active form of vitamin D in your skin. The caveat is that very few people will even acquire an adequate source of vitamin D unless they're really out burning. And so the answer I always give my patients, 'cause it's a very valid question, is generally the recommendation under the age of 65 is to have about 600 international units of vitamin D, and you can definitely get that from dietary sources like fatty fish. You can get it from egg yolk. You can certainly just take it in your milk or your vitamin D supplement. And I think if you already know that first slide that I mentioned, where you have fair skin and a personal or family history of skin cancer, you have a number of burns in your history, then I'd be really remiss to tell you to go out and get sunshine to get enough vitamin D, because there's so many other really safe, healthy sources. I think it is really interesting though, because dermatologists have this bad rap that we like hate the sun. And to be fair, we don't hate the sun at all. And I think adequate dietary and sunlight sources of vitamin D are fine. But the problem is I hate sunburns. And it's very hard to draw that line if you're out to get that 10 minutes you might need on your patio to get adequate vitamin D, and then to come in and put on your hat and your sunscreen and prevent the point that your skin turns red. Because we know as dermatologists that at the point your skin is turning red, you're accruing damage and mutations that can lead to skin cancer. And so if you're really meticulous and you set a timer on your cell phone and you want to go out or you take a very short walk with your dog or something like that early in the morning, and you feel like that contributes to your vitamin D stores, I'm a huge fan of that, because actually that's protective on so many different levels to many forms of cancer, including melanoma. But I think because it's so hard to draw that line and not go out and get burnt, that's why I'm a much bigger fan of supplements and dietary sources.
Inside, but there are windows.
Mhm.
And do you advocate for wearing SPF even if you're literally inside for much of the day working, but you have there's light coming through? Is that still damaging or?
So the short answer is yes, it is still
Yeah.
damaging, because that UVA, that longer, very penetrating wavelength of ultraviolet is still going to come through glass. And even though it's not quite as carcinogenic as UVB, as I mentioned, we do know that it contributes to the formation of skin cancer. And I think I almost put it in this talk, and I probably should have. One of the most striking photos I ever saw in training, and I think any doctor who's ever seen it can't shake it, is a photo of a gentleman who was a truck driver in New England. And the photo was widely circulated in the New England Journal of Medicine, where one side of his face was completely aged and didn't match the other side. And not surprisingly, it was the driver's side. And it really kind of drove home the point that through glass, you can still accrue tremendous photo damage. So that's kind of going back to what I was saying about a moisturizer with sunscreen that just becomes part of your routine. You brush your teeth, you put it on, then you don't have to remember to do it, because otherwise it's really onerous. Yeah, exactly. Like if you're someone whose desk is fortunately in front of the sun, we love living in Southern California. It's great that you get that warmth and that sun exposure, but just protect yourself, because you are accruing a lot more damage than you realize through the glass.
Sorry, other part of this is UV. Is there UV off of a laptop? I mean, is that UV light or is that?
No,
not-
interestingly, so
okay.
from screens, that's blue light.
Light,
And
okay.
I didn't address that, but many sunscreens now have another ingredient called iron oxide, and that will filter blue light as
So blue
well.
light also is something to be concerned about?
Not as far as we know from a carcinogenicity standpoint. So we don't view it as much as a risk factor for non-melanoma or melanoma skin cancer thus far, though I think with all of our screen addictions, that is to be determined in terms of cumulative exposure. But as of now, it's not thought to contribute to skin cancer. I will tell you that there's more and more data that it does contribute to aging of your skin. And so when we think about light sources also contributing to discoloration, hyperpigmentation, to collagen loss, there is some data to suggest that you should be concerned about your blue light exposure. And so I tell my patients who are on screens all day, do look for an added ingredient in your daily moisturizer sunscreen that's iron oxide.
Makeup or under their makeup?
So that's an excellent question. I always tell people under your makeup. I'll tell
Under
people
your makeup.
yes, and so I'll explain, because I want it to be part of your routine, whether you're wearing makeup or not. And so, for example, if you're someone who uses like an antioxidant, like a vitamin C or a moisturizer or something, I'll tell people go ahead, put those on. Then your mineral moisturizer sunscreen. If you're wearing makeup, great, put that on. And then one thing is, if you're out and about and you don't wish to disrupt your makeup because you're going to a lunch and then you're going to be driving and you're thinking you'd want to top up, because I'm explaining you should reapply every 2 to 4 hours, you can get really lovely, cosmetically elegant powder sunscreens that are mineral now. And that's actually what I keep in my car for the back of my hands and for over my face. That's what I put on before I walked in to give you this lecture today. And it just helps absorb shine, and it does give you that added layer, a powder mineral sunscreen, like a zinc titanium powder sunscreen. And that's a great way without disrupting your makeup to top up. But then you always know, whether you're wearing makeup or not, that you have that shield as part of your daily routine. Yeah, of course, you're welcome. Thanks.
Hi, we have another online question. If a gloss is applied over a matte SPF lip balm, does that dilute the SPF?
As far as I know, no, it doesn't dilute the SPF. And that's kind of along the same lines of the prior question as to where you put your sunscreen in the regimen. So if you are wearing a matte zinc or titanium lip balm and you allow that to set in and then you put a gloss on top of it, at least you can feel a little bit more comfortable that you have a base, that even if the light is penetrating and is less scattered, there's a physical shield on top of your lips. The caveat is, again, with that, you're going to have to reapply, because most of us in the course of drinking water from our bottles or eating or speaking, that sunscreen erodes much faster than anywhere else on your skin. Adriana?
More sun damage, skin cancer, precancers on the left side of the face in most of our patients, presumably from driving. Do you ever recommend to your patients to put a UV shield, the clear film, on their windows?
Yeah, Dr. Schmidt, great point and question as well. I do. So, and that's actually a very excellent point that I'd like to expand upon, because anybody who spends a long time commuting, you can get film added to your car at a body shop. There are many here in this area. And you just want to make sure that it's actually filtering ultraviolet wavelengths of light, because there's a common misconception among my patients that tinted windows equal ultraviolet protection. And actually, tinted windows, A, are going to get you pulled over, but B, they actually only filter visible light. So you want to make sure that that added shield is really filtering that very short UV wavelength of light, and then it's extraordinarily helpful. And yes, when my daughter turned 16, that was our first outing, was to a body shop on Lincoln. Again, no commercial relationship, and we put UV film on her driver's side window. Mhm.
What's important to go with that film on your side is a letter from your dermatologist that I have in my glove compartment that says, because of melanoma issues, that's medically required.
Yes,
So if
no,
you
and
are
that's an
stopped-
excellent additive if you get pulled over, if you have that added tool of the letter, hopefully they will not ticket you. And sometimes I've even been asked to write those letters after the fact because someone is contesting a ticket. So very good point. Yes, so chemo prevention actually ties in perfectly to the question that was asked earlier about creams being used for actinic keratoses. So those are creams that either directly attack rapidly dividing cells, and they're much more commonly used for non-melanoma skin cancers like actinic keratoses, as alluded to earlier, that are precursors to squamous cell carcinoma. So there are some that Dr. Margolin was mentioning, like, for example, imiquimod, that work with your immune system. And I always tell my patients, it's like tricking your body into thinking you're allergic to these precancer cells. It's like rubbing poison ivy on them and then watching your immune system go to work and just evict them. So those are immune modulators, and that's one category of the chemo prevention of skin cancer. There's direct chemo prevention and therapy, where you take something like 5-fluorouracil at a lower strength that's been around for a very long time, and because it's a chemo agent, it's taken up in those rapidly dividing cells and it evicts them. And then to answer your question, there's another route called photodynamic therapy, where we take a chemical and we put it on an area that's particularly prone to actinic keratoses, and we allow it to incubate for a couple hours, because again, it's going to be absorbed by those rapidly dividing cells. And then we expose people to a very specific blue wavelength of light that then activates that ALA chemical, and then basically creates a controlled sunburn where someone has precancers. So, and actually that whole armamentarium has been tremendously augmented. We have many newer agents. So interestingly, nicotinamide, there was a really elegant study, is what Dr. Asner is asking me about, which is an oral vitamin B. And the dose that was recommended out of Australia was 500 milligrams twice a day. And they saw that people who had a very high number of actinic keratoses had a lower progression to more keratoses and a lower progression to squamous cell carcinoma. And interestingly, Rick, I was recommending that for a very long time. And then just this year, of course, as always seems to happen with medical data, there were a number of reports that sadly people taking nicotinamide had a higher risk of certain cardiac events. And so I have put a pause on that recommendation till we have a little bit more data, because I think as much as I would love to prevent their skin cancers, I think you also have to look at incidence in the population. And if I'm contributing to a much wider public health issue by recommending nicotinamide, I'm not sure I really feel comfortable about that. Retinoids I also really like preventively. Those are vitamin A derivatives that help promote cell turnover and cell differentiation. So I think they're also great for anti-aging, just from a complete vanity standpoint, because they stimulate collagen and elastin. The only thing about retinoids, I would always say, if you would choose to incorporate that topically, is use them at night, because they have the maximum benefit and they do sensitize you to the sun. So if you do choose to use a retinoid, please don't put it on in the day, because it's actually going to increase the likelihood that you have sunburn in that day. But I do love retinoids, certainly as part of my arsenal. Good questions. Thank you.
Any other questions? Otherwise, I think you'll be here at the end, right?
I'm not sure.
Okay, she's
I
not
have
sure.
a daughter who is imminently submitting her college apps, so I promised her I would come back and help her out.
All right, well, thank you
All
so
right,
much.
thank you so much. Thanks for your attention.